For celebration, visit subway.ky to place your catering order today.
The Business Buzz is proudly sponsored by Cayman Medical Supplies. Call them at 949-6211. Cayman Insurance Center, celebrating 45 years in the Cayman Islands, specializing in property, life, and other lines of insurance products and services. And Digicel Business. Get everything your business needs in one package with Digicel Business Hub.
And now, Radio Cayman presents The Business Buzz, an insightful and fresh take on a variety of issues that impact the local business environment. This is where we address the business topics that matter. Radio Cayman's Business Buzz. Here's your host, Anita Khan.
Good morning and welcome to Radio Cayman's Business Buzz. This is our Thursday edition of the Business Buzz, and it's a pleasure to be in the studio this morning. I want to say thank you for Paula Cal, a.k.a. Silver Fox, for sitting in this morning. Susan is on vacation. Good morning, Susan. Susan is our producer of the Business Buzz, and as the intro said, I'm Anita Khan, and I want to say good morning and welcome to the Business Buzz, to our guest in studio.
Good.
I know I'm going to have a problem with her name this morning, but I'll try my best. I want to say good morning to Alska Haler. Good morning, Alska.
Good morning, Anita. Thank you for having me on your show.
You're very welcome. Alska is with Elevation Health and Physiotherapy, EHP, and we put the spotlight this morning on EHP. Alska is a physiotherapist, OMT, Certified Pelvic Health Therapist, BASI, Pilates instructor, and she's here to share some information about physiotherapy. Again, good morning.
Good morning. Thanks, Anita, for having me again.
I am looking forward to this session because I know absolutely nothing about physiotherapy. So this morning I want to learn. Paul, do you know anything about physiotherapy? A little bit, he says. Okay, Oscar, good morning again. And first of all, I'd like to ask you to share some information about Elevation Health and Physiotherapy, EHP. This is the first time, as I said, I'm hearing about EHP, so I want to hear more.
Thanks, Anita. Yes, and I'm happy to be here. So EHP is an elegant, modern, small physiotherapy practice equipped with everything patients need for their recovery. We have a strong focus on musculoskeletal rehabilitation, such as sports and orthopedics injuries, post-operative rehabilitation, and mainly we also specialize in a field called pelvic health physiotherapy. EHP started with the aim to provide high-level, comprehensive physiotherapy to the people of Cayman. We partner with our patients to empower them and help them overcome their injuries and conditions.
Okay, so when did you, why the interest in physiotherapy?
Well, for me personally, I guess I'm one of those really lucky people who can truly say that I love my job. As a young kid, I was a sports fanatic. Every waking hour was a sporting activity, planning one, thinking about one, and playing in one. And to my parents' pleasure, with a side of schoolwork at least.
What did you play?
I played hockey, field hockey, track and field.
Not ice hockey.
No. Where I'm from, it's a little hot for that.
And you're from?
South Africa, where there's no snow. But so with some schoolwork on the side, I also had a deep fascination with the human biology, physiology, and anatomy. So those two subjects for me were really passionate, and I guess so the obvious sports obsession and my love for biology and movement and my compassion towards people made physio kind of a sweet spot and a great job for me.
How is it going so far?
It's been 10 years.
10 years.
And still going strong, so I love it.
I can tell. I can just tell. If you're just joining us, you're listening to The Business Buzz. We just started, and we're speaking with, her name is going to give me a problem all morning, Alska. Alska.
You're doing good. Good.
It's spelled E-L-Z-K-E.
I respond to anything remotely like that, Anita, so we're good.
Oscar. Thank you, Oscar. So you moved, this was your journey into physiotherapy.
Yeah.
How did you, from from South Africa, did you come directly to Grand Cayman?
Yes, I did. I had a great opportunity to work here as a physio, and I continue to do that daily. So just serving the people of Cayman.
And you've been here for how many years?
5.
5. And you're enjoying it?
Yes. Who doesn't love the beautiful beaches that you guys have to offer?
Our 7 Mile Beach.
And there's so
especially.
many, again, like opportunities to be active here. The people of Cayman are very active. And that just puts us in a great position to keep them active.
Yeah. And keep us healthy as well. Now, what are some of the qualifications required to be a physiotherapist?
To administer physiotherapy, one has to obtain a degree in physiotherapy from an accredited university. The path to obtaining a physiotherapy degree can vary from country to country, and for some countries, I'm not even exactly sure how that path works. For instance, the US, they have a more complicated system. But once you have your degree, you have to register with that country's specific health professions council or governing body, and then you are eligible to work there, right? However, physiotherapy is a very broad degree that cover many disciplines, and most of us can choose to continue our education through obtaining rigorous postgraduate training and specialize then in a particular field of physiotherapy. For example, you have some physiotherapists who are pediatric physiotherapists, and they specialize in helping children with certain neurological or musculoskeletal conditions. Then you get, for example, your sports and orthopedics physiotherapists, and they specialize in musculoskeletal injuries such as lower back pain, knee pain, neck pain, joint sprains and muscle sprains, etc.
Okay. For Oscar's sake, Paul, I've got my...
I see she brushed up on her anatomy, and I'm going to do a test now.
Okay, test me. Come on. Okay, you're not going to scare me, right? No, that's fine. Now, what sort of services do you offer at EHP in relation to men's health and as well as women's health?
As I previously mentioned, yes, at EHP we focus on a specialized field of physiotherapy called pelvic health physiotherapy, and that includes men's health and women's health. And that's a really good question that you're asking, because not many people are aware of physiotherapy's role in men's health and women's health. So pelvic health is a speciality area of physiotherapy that focuses on the pelvic region, which includes the joints of the pelvis, the muscles of the pelvis known as the pelvic floor, and how these joints and muscles work together with the organs of the pelvis, such as your bladder, your bowel, and your reproductive organs. There are so many medical conditions that can occur in this area, and some of them can be attributed to the malfunctioning of the muscular and the nervous system that control the pelvis. And that's kind of where we come in. So some of these conditions may include things like incontinence, which would be the inability to control your bladder, frequent urination, such as overactive bladder syndrome, things like bowel dysfunction, constipation, even pain with defecation. Then pelvic pain, which could include anything from tailbone pain or any pain in any part of your pelvis. And then also conditions related to sexual dysfunction. In this field, we also have a strong focus on helping patients recover from surgeries in the abdominal and pelvic area, such as hysterectomies, C-sections, prostatectomies, etc. And then we also have a very sort of passionate bond with all the moms out there, either taking care of them while they are pregnant or after they've given birth to their baby, and help them manage sort of everything related to those parts of life.
It's amazing how that part of your body, do all those functions in just this one little area.
Exactly. And it's actually pretty amazing. And the pelvis really connects the upper body and the lower body, right? So it's really the link between everything.
The top and the bottom.
The top and the bottom, right?
You're in between.
It's your in between.
And it's funny that we do not take care of that in between, because we'll think about we have to take care of the rest of the body, right? But we don't think about that part as important as your heart, your kidney, your lungs.
I think that some of that comes down to the fact that pelvic health issues can be very embarrassing and uncomfortable. And they can also be very disruptive to our lives. And they're not often our topics of discussion. I think it's much easier to tell your friend you have a heart condition
right.
than you
can... a kidney stone or something,
Yes, exactly. Or I can't control my urine. That's not something you go around telling everyone. But we want to kind of bring out those taboo topics, talk about them, and we're all human, so we all have these functions, right? And when they're not working, it becomes really, it reduces our quality of life significantly. So we want to address them and help people improve their quality of life regarding this particular field. So, and we think this might be the first time you're hearing about this, right? So, but actually, if we look at some statistics, at some part in their life, 1 in 3 women have urinary incontinence. That's a lot. Yeah. Yes.
1 in 3.
1 in 4 women suffer from pelvic organ prolapse, for instance. And 1 in 5 women suffer from chronic pelvic pain. So that's quite a lot. And then on the other hand, we always think it might just be women and, talking about that. But men also suffer from these conditions. For example, at one point in their life, 30% of men who visit their doctor will have issues controlling their bladder.
And this is not because they've had to bear a child or... No,
it's just because of the general wear and tear of life, activities. Men, on the other hand, might struggle with prostate and dysfunction, even cancer, which can contribute to these issues.
We're speaking with Alska Haler of EHP, and it's Elegant.
Elevation.
It can call it, it sounds elegant to me so far. Elevation Health and Physiotherapy, EHP, that's an easy way to remember. And we're going to take our first break, and when we come back, we have a lot more to talk about. Alski, hope you're prepared for this.
You're doing the test today.
Thank you, Paul. Thanks to our sponsors this morning, Cayman Medical Supplies and Cayman Insurance Center.
For 46 years, our Cayman Insurance Center family has worked to protect your family and your most valuable assets. And we are happy to announce that our offices are now reopened to better serve you. For your added convenience, you can also make payments online or make inquiries by phone or email. Whether you need to get a quote, renew a policy, or file a claim, Cayman Insurance Center is here to protect you and your family. As your family's health is everything, do all that you can to protect it. For your family's safety, social distancing practices are in effect at our offices, and masks should be worn. From our Cayman Insurance Center family to yours, stay safe, stay Cayman strong. For more information, call 949-4657.
Oh gosh.
Don't let the stress of taking care of loved ones get you down.
Home care, now made easier with Cayman Medical Supplies. 100% Caymanian owned. Cayman Medical Supplies now stocks a wide range of home care supplies. Hospital beds, all types of wheelchairs, including beach access wheelchairs, lifts, commodes, shower chairs, walkers, Curad brand orthopedic supplies. Free blood glucose monitors with the purchase of 1 pack of test strips, blue underpads, and a whole lot more.
Need home care convenience? Drop by Cayman Medical Supplies at 93 Smith Road, Windward Center, or call 949-6211. Free delivery.
Open 9 a.m. to 5 p.m. Still delivering island-wide for your convenience.
That thing we've been saying for 64 years, ignore it. Eat the KFC wings, drink the KFC gravy, fill up on fries. Just please forget the thing we normally suggest. You know, that thing you used to do with your tongue after finishing a delicious piece of our KFC chicken. We get it. It's not easy. There's a reason why it's been our slogan for over half a century. But the world's drastically changed of late, and as soon as we can embrace the change, the sooner we can all get back to doing what we do best. KFC. It's good.
Mr. Bernie Bush, political candidate for West Bay North, will be holding a public meeting this Saturday, March 20th from 7 to 9 p.m. The meeting will be held in the parking lot of Inferno in West Bay. West Bay North voters, you are invited to a public meeting held by candidate Mr. Bernie Bush this Saturday, March 20th from 7 to 9 p.m. at Inferno parking lot. Guest speakers include Chris Saunders, Sammy Jackson, Johan Moxham, and Arden McLean.
Business Buzz. Business Buzz with your host, Anita Khan.
Good morning. Welcome back to the Business Buzz. It's 26 minutes until 9 o'clock, until Paul brings you some good music at 9 o'clock on the breakfast session. But in the meantime, we're speaking with Ms. Alska Haler. Alska is a physiotherapist, OMT, certified pelvic health therapist, BASI Pilates instructor. Alski, I've got so many questions for you. Are you ready?
I think so. Hit me.
No, before going to the break, we had quite a discussion there. Now, referrals. How does as I walk into the room, you can tell I have scoliosis, right? Mm-hmm. You did?
Yes, a little bit.
Okay. Now, most people do that. Most doctors would say, "Look at me, go. You have scoliosis." And I'm like, "Yes," but it doesn't hold me back from enjoying life.
That's fantastic.
I just go about my business and sit up as straight as I try to sometimes. But most time my producer Susan would say, "I need you have to sit up." But sometimes it's hard to sit up if you have scoliosis.
Yes.
Because it hurts. It does hurt at times.
Yes.
Now, would I need a doctor's referral to be treated at EHB?
That might seem like an easy question, but it's actually a hard one. Mm-hmm. The answer is yes and possibly no.
Okay.
Seeing that whether a referral is required is determined by your health insurance provider. So I would really advise patients to either check with their health insurance provider whether they require a referral for physiotherapy, or they can just contact us and we can help them understand whether they require a referral. Some insurances are happy for you to attend physiotherapy as a first-line medical profession. Others require you to have a referral from your general doctor.
Okay. Now, what would someone coming in to EHB, what would you expect on their first visit? So,
Anita, on the first visit, we usually focus on a thorough examination. Mm-hmm. So that would include a consultation and a good medical history taking, as well as a physical exam, which will include a movement analysis and some tests to get to the root cause of their problem. Without a thorough medical examination, we often end up treating symptoms rather than root causes. And at EHP, we really want to try and understand where are your symptoms coming from and how can we help you improve that. So your first visit will mainly include a thorough assessment and then a treatment plan, and we usually have some time for treatment as well.
Okay. Sounds like a good plan. Now, what types of injuries do you mainly treat or specialize in? You did mention some, but what have you seen coming to you more regularly? What sort of injuries?
So, as I mentioned previously, I initially did a postgrad specialization in sports and orthopedics, and then practiced for many years. And then after my own little encounter with pelvic pain, I did my postgraduate qualification in pelvic health. And so that specializes me particularly to deal with certain conditions relating and combining those two fields. So it could be anything from someone like yourself with scoliosis, or someone who just had a knee surgery, or someone who had a hysterectomy. A lot of patients who just had babies and struggle with post-childbirth, postpartum conditions regarding their pelvis. And so it's actually quite a variety. But I think off the air I mentioned to you that the pelvis is connected to the upper body and the lower body.
Right.
And so the orthopedic and pelvic health structures interact with each other. So that's my specialty field.
That's awesome, because you know exactly what you're looking for. You specialize in that area, and you know exactly how to treat it, how to diagnose, and how to educate me on taking care of myself.
Yes.
Manage my pain and my pelvic.
Exactly. We have to take note that we work with the doctors closely in this field. A lot of non-musculoskeletal conditions can arise in the pelvis as well. And we have to make sure that we've first eliminated them as possible causes. So it's not kind of a solo physiotherapy treatment. It's very much a multidisciplinary approach. But these conditions can be multifaceted. So working with other healthcare professionals are also very important.
I could tell you enjoy your job, Aski.
Yes.
Now, how important it is for to offer patients their educational tips about their conditions, so that this way they can minimize their symptoms and maximize their function as part of their rehabilitation program.
Anita,
it's a long question.
Yeah, that's okay. One I love.
Okay.
I can't emphasize what you just said anymore. Like, understanding your condition and knowing what you're dealing with and how it can be treated is critical to getting better. Mm-hmm. And education help us kind of partner with our patients on their road to recovery. It's not just I'm treating you and that's going to make you better. You have to get involved in the process and want to get better and need to understand how your body works and how it's going to get better.
So this is basically an interactive patient physiotherapist sort of connection.
100%, which is a lot more fun too. We have a lot of laughs and a lot of, we get to know our patients really well.
You have your patients go home and Google, every part of their body or their skeleton.
Just like you.
Yeah. When I saw that I was interviewing this morning, I'm like, I know nothing about physiotherapy, so let me get the skeleton out and let's do some work. Let's get to work. And I'm happy I did, because I realized how important, I think this morning is when I realized how important that area of your body is, your pelvic area, Yeah. And that's why we have so many problems. Even women, your stomach, after having a baby 35, 36 years after, your stomach is still ugly looking, I don't mean that, but it's just, if you don't take care of that part of your body, it can't take care of itself. You have to take care of it. That's how I see it. But it's important. Now, Aska, let me ask you, how long does each treatment last? And how many visits your client need?
Anita, the how many visits is a hard one. It's really tailored. It's really tailored to each patient, their injury, their condition, how long they've had that condition. There are general guidelines that we can use to discuss that with patients on an individual basis. Then regarding the treatment sessions, all initial visits are an hour. Like I said, we need to do that thorough assessment. Right. So that takes a bit of time. And then because we're such a small boutique practice, we actually tailor the follow-up visits to what our patients need. And that can vary from 30 minutes to an hour. And that may vary from visit to visit as well. It really depends on what you need to get better.
Fair. Can you elaborate on the main services at EHP? And this is relating to sports and orthopedics.
Specifically to sports and orthopedics, we...
and I know sports is your...
yes. Yeah, that's how it started. Right. And I still have a big love for it. So I keep that going. As mentioned before, there are a plethora of conditions that fall under that. So it can be anything from ankle sprains, foot pain, something called plantar fasciitis, tennis elbows, hip pain, hip surgery, headaches, neck pain. A lot of our headaches can even come from our neck. And so sports and orthopedics can sometimes be misleading. I think most of us get those injuries by not playing sports, by actually sitting at our desks in front of our computers. Exactly. So it can be any condition, whether it's office acquired or sports field acquired. And that kind of brings us to another service that we also offer, which is our corporate health service. And that kind of feeds into that as well.
In Cayman, what sort of... say sports injury are you seeing more of?
throughout my life and in Cayman, it kind of goes through phases. And where one time I actually thought that we misspelled physiotherapist as foot therapist because I'm pretty sure for a month I saw only feet, and I was like, wait a minute, there must be an error on the advertising here. So it goes through phases. We do see a lot of knee injuries. I think knees are things that often get hurt. And then if we just think about prevalence of lower back pain globally, it is a huge also pandemic, if I can put it like that. So I spend a lot of my day treating people with lower back pain.
Why do you think that's a problem?
I think we spend too much time sitting. Yes. And
does it have anything to do with weight? Your weight, carrying all that weight around,
yes.
Especially your midsection?
Yes, weight can play a role for sure, because you can see how small your skeletal structure really is. So your joints and your muscles have to carry the load, but it's not always the ultimate, sort of causative factor for back pain, but it is a contributing factor. I'm pretty sure. If you're just joining us, you're listening to the Business Buzz on Radio Cayman, and we're speaking with Ms. Alska Haler. Alska is a PT, BSc Physiotherapy, OMT certified pelvic health therapist, BASI Pilates instructor. And when we're going to take a break, when we come back, we'll just touch a little bit more on corporate health. Perfect.
If Alska is up to that. In the meantime, thanks to our sponsors, Cayman Medical Supplies and Cayman Insurance Center. Oh gosh.
Don't let the stress of taking care of loved ones get you down.
Home care, now made easier with Cayman Medical Supplies. 100% Caymanian owned. Cayman Medical Supplies now stocks a wide range of home care supplies. Hospital beds, all types of wheelchairs, including beach access wheelchairs, lifts, commodes, shower chairs, walkers, Curad brand orthopedic supplies. Free blood glucose monitors with the purchase of 1 pack of test strips, blue underpads, and a whole lot more.
Need home care convenience? Drop by Cayman Medical Supplies at 93 Smith Road, Windward Center, or call 949-6211. Free delivery.
Open 9 a.m. to 5 p.m. Still delivering island-wide for your convenience.
For 46 years, our Cayman Insurance Center family has worked to protect your family and your most valuable assets. And we are happy to announce that our offices are now reopened to better serve you. For your added convenience, you can also make payments online or make inquiries by phone or email. Whether you need to get a quote, renew a policy, or file a claim, Cayman Insurance Center is here to protect you and your family. As your family's health is everything, do all that you can to protect it. For your family's safety, social distancing practices are in effect at our offices, and masks should be worn. From our Cayman Insurance Center family to yours, stay safe, stay Cayman strong. For more information, call 949-4657.
Making a dent in traffic congestion is everyone's responsibility. This March 22nd to the 26th, join your community for Car Free Week, a countrywide initiative by the Ministry of Commerce, Planning and Infrastructure, carpooling, cycling, public transport. Join a park and ride program, or perhaps working from home. Your boss will understand. Visit energy.gov.ky for more information for park and ride options. Take the Car Free Pledge and enter into the raffle. Traffic may stand still, but the Car Free movement is moving ahead. Join your community. Take the pledge March 22nd to the 26th.
The Ministry of Education provides funding to assist Caymanian children who turn 3 years old before September the 1st to attend an early childhood centre. This funding is available through the Early Childhood Assistance Programme, ECAP. Parents and guardians are now invited to submit ECAP applications for the upcoming 2021 to 2022 academic year. Application forms are available at the Government Administration Building, early childhood centres across the island, or online from the Ministry's website at www.education.gov.ky. For further information, please call the Early Childhood Unit at 244-3155. Completed application forms may be emailed to ecap ecap@gov.ky, that's ecap@gov.ky, or delivered to the Government Administration Building.
Are you one of the pensioners on island at risk of having their monthly payments stopped? The Public Service Pension Board would like to remind its pensioners that their annual pension continuation certificates, PCCCs, have been distributed through the mail. To ensure continuity of benefits, please return your PCCC by March 31st. If you have not received your PCCC form, please feel free to drop by the PSPB office located on the first floor of the Government Administration Building to address this matter. If you are a shut-in or have care or control over a pensioner who is unable to be transported to the PSPB office, please call 945-8175 or 244-7123 for special assistance.
Business Buzz. Business Buzz with your host, Anita Khan.
Welcome back to the Business Buzz as we head up to 9 o'clock. I want to say thank you to Ms. Alska Haler from Elevation Health and Physiotherapy, EHP, for sitting with us in the studio this morning and speaking mostly about physiotherapy. Alska is a certified pelvic health therapist. Alska, I'm learning so much this morning. Thank you.
You're welcome.
I want to learn a little bit more about corporate. Let's touch on corporate health. A lot of us can't afford, ergonomic chairs, is that what you call them, and office equipment. What tips can you give to those folks who are listening and want to sit better, or what sort of posture to have while working, stuff like that?
Yeah, definitely. I think most of us spend a lot of time, in our environment working, and it takes up a lot of hours in our day. So having some strategies to sort of prevent injuries while you're at work and is really important for us. So I think if you don't have all the equipment that you need to be perfectly ergonomic, there are definitely tailored solutions that we can help troubleshoot you with, again, on a more individual basis. And that's what we offer. We come to your office and we try and work with what you have, firstly, and then maybe recommend a more expensive purchase. But we always try to work with what patients have. My most important tip would be to move.
To move?
Yes.
Would that be to the coffee machine or to the water cooler?
Water cooler, and if you come to my office, will be coffee too.
Most times I come downstairs and harass the guys in the studio.
Yeah. It isn't just necessarily like getting up, right? Yes, getting up is extremely important, and every hour, even if you just stand up and walk around your chair, that's enough just to get your blood flowing and your joints moving. Sometimes that little backache that you're feeling isn't always the chair. It's kind of your body saying it's time to move.
To move. I like that. Now, what sort of you did touch on how you help with corporate health. You come out to the office and you give recommendations and stuff like that. What else do you do as part of your service?
Yeah, so as part of that service, it includes something called a functional analysis, which is the part that we come to your office. We assess how you engage with your workstation and perform your tasks. And it can be in other professions as well. Like for me, I don't sit at my desk that much. I stand around that physio table, but I still have to engage with that table. So it's looking at all the equipment that people use. Then we offer practical solutions, so evidence-based solutions on how to change. We will give you a document on the changes that we recommend you make. And as I mentioned, we try to work with what you have first, and then we make recommendations on other products that you can purchase if necessary.
Very good.
Then we do a prevention analysis, which is identifying the habits that can place potential unnecessary strain on your body that may lead to something that we call repetitive strain injuries. So if you don't have something wrong with you right now, that's a good time to kind of help sort of identify those areas where you can improve to prevent that. And then we also offer active treatment, which is if you already hurt somewhere, we can provide you with physiotherapy treatment for that condition.
Very good. Now, mobile. If I'm unable to come to your facility, do you offer any mobile services?
Anita, we try to meet everybody's needs. So in special cases, we definitely make special arrangements.
Okay, so if I need you to come and give me some physio, you can do that. Now, quick question. Where are you located? That's important. Very important.
We are located in on the second floor of the Fidelity Financial Center.
Okay.
On West Bay Road, and most people know the restaurant Blue Cilantro. We are just on top of them.
Okay. So you smell all that good food all day, do you?
Yeah.
Now, this is the part that I'm interested in, Pilates. You offer Pilates sessions. Can you tell us a little bit more about those sessions and how it works?
Yeah. So we mainly use Pilates at our practice to enhance patients' rehabilitation and recovery. So clinical Pilates is a corrective system of exercises that focus on training your body to develop your core strength, your muscular control, and postural awareness, allowing you to move in the most efficient way, right? So we use it after injury, to recover from an injury, during pregnancy, post-pregnancy, and then also just to improve someone's sporting abilities. It can really, I always say, like, even rugby players have to do Pilates to be better rugby players.
Really?
Yes.
Didn't know that. Didn't know that.
Yeah. So our sessions are 1 hour, and they're completely tailored to what you need.
Okay. Now, because I'm thinking about Pilates, my body can only move so far. I'm only this flexible. And I've seen where people stretch to the max, and I'm like, how on earth did they get to that? But I realize that your body can go as far as you push it, right?
Yes.
Yeah.
But we can also, Pilates can also help you just move where you are. We can meet you where you're at. So those Pilates principles can apply from a very beginner's level to a more advanced level. So you don't have to be concerned.
I was looking at your website. You have a beautiful website.
Thank you.
And I noticed you have a quote from Joseph Pilates. And I quote, "A man is as young as his spinal column. If your spine is stiff at 30, you are old. If it is flexible at 60, you are young."
100%. He was a good man.
He knew exactly what he was saying and what he was doing. Now, do you, in your spare time, do you practice yoga? Maybe?
Yes. I do dabble with, as you know, a lot of different exercises and body movement. So yes, I definitely enjoy keeping my spine flexible as well, so I can help everybody else with their spines.
Thank you. Otherwise, we'll be lost, right? Now, what are your open hours, Oscar?
Anita, we are open Monday to Friday from 8 a.m. to 5 p.m.
Okay.
And then we also do after hours and Saturdays, but that will be by appointment only.
Okay. And speaking of appointments, those who are interested in coming over to EHP, do they have to make appointments?
Yes, they do.
Okay.
So we have a great online booking system. So if they want to visit our website at www.ehphysio.ky, they can book online, or they can call us to make an appointment at 623-6663. Also, a simple Google search for EHP Cayman should just provide a direct link to our website, and they can find other information about where we're located, services that we offer, and even make a booking.
Okay. Anything you want to recap on before we end the session this morning?
Yeah, thanks, Anita. Physiotherapy is a well-established medical discipline with many specialities, and EHP is a boutique specialist practice qualified to meet your sports, orthopedic, and pelvic health needs.
I like that pelvic part. That works for me, because I'm going to go home and look at my pelvic area in a different light this afternoon.
Yes.
I vow to take more care of that area.
Your body will thank you.
It will. I'm pretty sure. Oscar, I want to say thank you so much, and we'll definitely have you back in here at some time to just expound on a lot more on what you do, what you offer at EHP.
Thanks, Anita, and thanks, Radio Cayman, for inviting me.
Oh, you're very welcome.
I really appreciate it.
Susan does a good job putting these questions and torturing you.
Yeah,
so
she did.
Thank you, Susan. And we'll see you next time. Again, please make an appointment and speak to Alska, and she'll get you body ready. Want to say thanks to Paul, our mixer man this morning, cameraman, doorbell guy. He just did about everything this morning. Thanks, Paul. And also to our producer, Miss Susan Watson. Susan is off on vacation. And want to say thanks to our sponsors, Cayman Medical Supplies and Cayman Insurance Center. Thank you so much for your sponsorship of the Business Buzz. Without you, we could not do this. And if you'd like to sponsor the Business Buzz, please call somebody in our sales department, either myself, Kathy, or Ray, and we'll take care of you and get you started on the Business Buzz. In the meantime, thanks to all our listeners and our viewers on YouTube. Meantime, have a wonderful rest of Thursday, and weekend is coming up. Enjoy.
The Business Buzz is proudly sponsored by Cayman Medical Supplies. Call them at 949-6211. Cayman Insurance Center, celebrating 45 years in the Cayman Islands, specializing in property, life, and other lines of insurance products and services. And Digicel Business. Get everything your business needs in one package with Digicel Business Hub.